This is Healthcare That Clicks, where healthcare, innovation, and big ideas collide. No fluff, just the strategies reshaping the future of care. Here are your hosts, Ryan Kelly and Will Moon.
Welcome back to Healthcare That Clicks. Today, Ryan and I are diving into the world of direct-to-consumer telehealth. Think Hims and Hers, Ro or Roman, and the whole wave of brands making healthcare feel like a lifestyle service. How are you, Ryan?
Good, Will. How are you doing today?
Good, man. I look forward to our little conversations and powwows, fireside chats.
Absolutely. And this is one that, we see on commercials all the time on TV. Like you said,
much.
Hims and Hers. I mean, how many of these companies exist now that are kind of niche in the market? They're not dealing with the broad spectrum of telehealth like we see, but it's growing in popularity. What have you seen with these direct-to-consumer companies that you think is kind of giving them that niche? Why do you think they exist in the way they do right now?
I think a lot of them have really focused on the consumer experience. And so, even with traditional healthcare companies, when we think about Teladoc, American Well, some of those long-standing players, the user experience, the UX, or the patient experience still feels very clinical and still feels very medical. I mean, if you look at some of these brands, like Hims is a great example, locally traded company, they're killing it. I mean, they were like literally in 2024, they were, I believe, like a $2 or $3 billion in valuation company. And I think today they're sitting somewhere between like 10 and 14 billion.
Wow.
So, I mean, just within a year, they doubled revenue year over year for like the last 5 or 6 years. It's incredible.
It's amazing.
But if you look at the branding, like the color schemes, the fonts, the packaging, the messaging around it. I mean, you mentioned the commercials yourself. Think about some of the, and I mean, it's even like, I saw one of them the other day, and, we're on a podcast, so we don't have to go too far into it, but it's called Bent Carrot. It's an erectile dysfunction one. And so I think a lot of them are just really playing into that marketing and that branding and fitting more into a consumer lifestyle experience. And it feels less clinical. And so people can participate a little bit easier.
Yeah, well, it's like you said, these are services that are not necessarily ones you want to advertise on billboards that you're going to go and receive. So
Right.
hair loss, you said erectile dysfunction. These are kind of private things, not much undifferent to telepsychiatry and the boom we've had in telepsychiatry.
Right.
If you're a small town and everyone sees your car in the parking lot, you may be there for very good reasons, maybe not. Most likely are, but people start talking. And once they start talking, oh, Jane Smith is there, the doctor. I wonder what's going on with them. These are things you don't want everyone to know about for right or for wrong. And so I think these companies exist to help a little anonymity for people to get the services they need or want without everyone just knowing about.
Yeah, absolutely. I would even go as far to say that by focusing on the stigmatized kind of diagnosis or issues that some patients might struggle with, they have branded it and built lifestyle brands around that in a way that is starting to destigmatize some of these things where they're becoming more acceptable to talk about. I mean, and it's not necessarily like a direct to consumer one, but kind of an adjacent one would be like, low testosterone for men.
Yeah. Very good one.
There was a day where no man would tell you that they were on TRT. But nowadays, like, it's no big deal to say, yeah, I go to my men's health clinic and I've got TRT. And
it's almost a brag point in some ways.
Yes, exactly.
Yeah, absolutely.
And so same with like Hims. People are not afraid to say like, oh yeah, I got a Hims prescription, helps with my receding hairline or whatever it is. Right.
Yeah. Well, and you think others, menopause care, sleep apnea was one that kind of had that same kind of a stigma for a while, and that became a little more commonplace. Gut health, the probiotics and everything that we see now, all of these at a time, and some of them now are, not necessarily cultural norms for people to talk about and to go and seek care for. We saw it with postpartum depression with women for a long time. And now fortunately, that is becoming mainstream to talk about and receive help for it. But all of these are niche in nature. They're not necessarily for the grand consumer base, but all of them obviously have a tremendous need and a tremendous following, which is why, like you said, the value of these companies is just increasing tremendously year over year as people see the opportunity and they're seeking those opportunities. And many of them are returning customers, like testosterone, great example. Once you start taking testosterone, you can stop, but all of the benefits will cease at that point.
Right.
So
Yeah.
you're a lifetime customer at that point.
Yeah. I think you just kind of hit on two important things that we could, segment into a little bit. One of those being the business model aspect of it. And that we look at traditional telehealth models. I kind of go back to Teladoc, Amwell, 98.6,
Hmm.
MD Live, Sesame. A lot of those companies were like early competitors for us that we kept an eye on. And they went, all things to all people. They wanted to be primary care. They wanted to be specialty. They wanted to work with all different types of groups, but it was a pay as you go model or a
Hmm.
pay per instance model. And that's where a lot of these niche companies are really winning, honestly, is they've built in or figured out the recurring model where it's subscription based, geared really around telehealth plus telepharmacy. Get a diagnosis, get a medicine, which could actually, with our position within telehealth in Mississippi, it might be worth having a conversation about some of the bad actors in that because of the incentive to get a diagnosis, to get a recurring prescription from a revenue or a business model standpoint.
Exactly. Um, Yeah, and so that is one of the things that I know we've looked at quite a bit from the negative side of telehealth is you do have people that are abusing the system, and obviously there's news reports that come out that highlight these abuses, and we should highlight those abuses because, like with any system, there's going to be bad players that are going to take advantage, and they would do that literally with anything that we built. And unfortunately, telehealth is one of those systems that can be taken advantage of, but literally you can with anything. And so we'll talk about that in a bit. I'm curious, obviously entrepreneurial minded, both of us are, and in the idea of coming up with a new idea. And obviously,
There
there's
you
some
go.
new ideas we've talked about. What are some of the new ones that you think maybe, if you have any in mind, are soon to come from a telehealth perspective and kind of this capitated or membership based subscription model?
Yeah, and that was the second kind of thing that you had previously mentioned outside of the business model. But there were two opportunities that you mentioned: postpartum and menopause care.
Mm.
And I think women's health, especially for this direct to consumer market, is a hugely underserved market right now. There's a
Absolutely.
lot of need. Like I even went and did some keyword search results using Google keyword and was looking through I use ChatGPT to kind of help get my SEO terms. But I was looking
Mhm.
up the metrics just on different search terms around postpartum specifically, because you're a dad, I'm a dad. Watched our wives kind of go through something after each kid, and having resources or some sort of care plan available for them right after. It's kind of there's a lot leading up to the birth, and then after the birth, it's like, all right, we'll see you at your next 6-month appointment for the
Mhm.
mom. And then, there's the babies are still followed. I think just based on the trends from the searches, there are a lot of women out there looking for care in those two areas specifically because they can be a little stigmatized. And, maybe the ladies are in areas where they don't have access to certain types of care, or, because of the way that healthcare is structured now, maybe providers that are a part of healthcare systems don't have models set up for that. It's more of just traditional OB visits and they're focused on volume rather than, these long-term kind of care plans or care models. So, I would say those two areas specifically, and you hit them. So you've done your research, obviously.
Yeah, no, I think you're exactly right. I think the OB care and maternal health is a huge one. Just as a quick aside, I've been working in a few states with the rural transformation funds as part of the One Big Beautiful Bill,
Yeah.
and looking at how the money will be spent per state. For those who are unfamiliar, and of course, this may date this podcast here. This is late August. And so the different governor's offices in each state is taking the money that's coming from the One Big Beautiful Bill that's focused on this rural transformation program. There's 50 billion for the entire country. That's money is being split. Mississippi should get somewhere around 175 million per year for 5 years. Different states are different dollar amounts, and so I could give you the dollar amounts for the different states around us as well. But the low is around 75 million
Mm.
for very urban states, and then the high is basically what we are. We're towards the top in Mississippi, at least, and so that money is being decided where it's going to be utilized. One of those big areas is maternal health. And what we can
Interesting.
do as a state to help foster improved maternal health and improved outcomes, and to really transform maternal health care. And I think this is a great example of what we can do by providing a very hands on solution for expecting mothers and women who've recently given birth. I think that this can be a tremendous benefit to both the health of the baby, the health of the mom, and the success of that first year of pregnancy, or post delivery, rather, because that is really the crucial stage that's going to determine the health and well being of that child and that family.
Yeah.
So something like this is a perfect kind of a solution where we can tailor the needs of the mom and the questions that a new mom has, because as we all know as parents, there is no instruction manual that God
Right.
gives us when we have kids. They pop out and we have to figure it out based on either what people told us, right or wrong, or just what we can determine as creative as we can be. And so having someone in your corner to help coach you and help you through this is really, really helpful. So I could see that being one of those elements. I'll tell you another that I could really see as well, and this just comes from from having kids that are in sports, is the sport coaching, sports psychology side. I found it very hard, easy to find good people that can help coach your son in baseball, but hard to find someone who can really dive into the mental side of the game. My daughter's a cheerleader, the mental side of tumbling. There are people that are psychologists and sports psychologists even, but really who understand sports specific psychology,
Mm-hmm.
like tumbling and gymnastics,
Yep.
is pretty minimal. So I can see even the sports side, as kids are in travel competition level sports. Volleyball is really big, softball, golf, soccer was the one to start it all. Even bass fishing is getting big now as a competition sport,
Yeah. Yeah.
pickleball. All of these I could see as, too small for a local market for someone to be able to do it. But as a national or even global market, I mean, I think anyone could do really well in something like.
Yeah, and I think those are both of those, whether we're talking about menopause or postpartum care, so like the women's health direct to consumer opportunity, or even if we're getting into the mental side, like not just mental health, but like we're talking about like sports psychology, like really niching down. Both of those opportunities are entrepreneurial opportunities that can be picked up and run with by local communities on
Mhm,
certain aspects. Like, you could have local community health systems that offer postpartum care.
mhm,
Let's say like Baptist, when
mhm.
they deliver, they could have a postpartum program that they enroll new mothers into that looks like XYZ, right? And maybe it's geared around some type of prescription. That seems to be the most common, because it's still hard to get direct to consumer to pay directly for things. We want to figure out an insurance model. That seems to be the most kind of obvious one. But then you've got, like you're talking about, like sports psychology, which may not be a local opportunity for direct to consumer, but presents a national opportunity. And so I think the important thing there is direct to consumer telehealth still presents a lot of opportunity, still a ton of underserved areas in the healthcare space. And it can look like, this on a local community basis, or it could look like this on a national basis.
Yep, absolutely. And so you mentioned Baptist is a good example, St. Dominic, so many others that
Right.
they have a population base within their system, whether those are patients seeking primary care in their clinics or some level of inpatient surgical or specialist care in their various facilities. They also have, senior living and other sort of services where people are living within those communities. All of these are within their profile of a patient population. And so I could see it to where their providers and those within their umbrella could provide these services to that vested patient population, either as a value add, to reduce some of their costs in their accountable care organizations, their ACOs, or to actually provide additional services for those facilities and increase their reimbursement rates. So
Yeah.
I could see really both sides of it: the wellness, the prevention, the cost avoidance, but also generating revenue just from that patient population.
Yeah, and kind of an interesting hot take. No, we tried offering direct primary care as a service line years ago, and it was still just from a regulation standpoint and the way that you had to offer it, patients had to opt out of insurance, and there's just a different kind of insurance model that patients had to sign up for that they weren't used to. And so, ultimately it didn't work out and a lot of lessons learned. But the hard thing there was just that, that monthly cost for the membership and understanding that it did not substitute for insurance. It wasn't like, taking your insurance premium from $700 a month to $70 a month. This was
Mhm,
more of, like primary care and preventive care,
mhm,
and kind of urgent care bundled into one. And so the hot take there is that recently it has been opened up for not just direct primary care, but some of these concierge medicine models, which is similar to what we're talking about. And we were talking about we just mentioned the business model side being largely driven by prescriptions, telepharmacy, right?
mhm,
To get that recurring because prescriptions get refilled. And so there's some recurring revenue that's baked in there. But now HSA and FSA accounts have been opened up to direct primary care and concierge medicine. So depending on, your state's laws and regulations around direct primary care specifically, you may want to look at concierge medicine, which
mhm,
is where you could offer some of these programs direct to consumer that doesn't involve a prescription model so that we kind of take that element out of it, right? We're not just driven to diagnose something because that's the only way we get recurring revenue.
mhm.
We can provide value in the service and then it can be paid for through an HSA or an FSA account.
Absolutely. So it's funny you say that because I just had a conversation with a provider and with an insurance company 2 weeks ago. The insurance company was last week. The provider was 2 weeks ago
Yeah.
about this exact concept. So the
Okay.
provider was interested in doing direct primary care, but
Okay.
the conversation I had with that provider is the insurance product oftentimes does not catch up with the delivering of the primary care. So ideally, and you tell me from your experience what this looks like, but you would want an insurance product that carves out primary care because you're paying for that out of pocket through that membership based concept for that provider, but you still need all the other elements of healthcare. So you
Mhm.
need most likely the pharmaceutical side. You definitely need the catastrophic care side. So anything inpatient or with a specialist, you need that as that piece of that healthcare. But a lot of the cost of our health insurance is focused on the primary care side, which of course we could pay for out of pocket with this direct primary care service. Now, ideally, the provider, their goal is to keep you healthy, keep you well, which is exactly what our modern healthcare system is trying to get people to do is focus on wellness and prevention. Well, direct primary care is the perfect model because if that provider keeps you healthy, you don't need that provider and they can go play golf all day or do whatever they want to do. They don't have to spend time on sick visits because everyone's well, everyone's healthy, and they're paying their membership because, hey, I'm healthy, I'm well, I'm going to keep this going. But the trick is, like you said, the insurance product.
Right.
And so the insurance company I talked to, and they do more corporate insurance, but I think these are getting to be more and more available. And like you mentioned, the health savings accounts, the HSAs are now catching up to this. There's products that can be custom designed to carve out the primary care side, lump it in with an HSA and with direct primary care, and make this a bundled opportunity that would be available for a hospital or a clinic system to be the delivery model for that primary care, but also could be for just a direct to consumer, individual person. Maybe they have a job somewhere else and they work for someone. Maybe they're self-employed and they could have a product that is custom designed for their needs. So
Yeah.
I hope we're catching up, but tell me your experience because you've dealt with this firsthand. I'm just kind of catching it secondhand from others.
Yeah, no, I think you're hitting on something important there. And it's that the insurance products and the ways that the brokers, like the kind of creative structure that you're talking about now, even just 5 or 6 years ago, the brokers weren't willing to look at,
Mm,
honestly, and so, even like up until 2019, 2020, the best option for a direct primary care model, because like you're talking about with the primary care side, I mean,
mhm.
that accounts for like 50% of your
Yeah.
plan.
Yeah.
And so a lot of people were, like we did have patients enrolled. We just didn't hit that sustainable threshold, and you needed a market of about, 500 to 600 patients in a caseload to
Mhm,
really make it work for the physician.
mhm,
And I think we got up to a little over 200, but it was still early, honestly. And I know you know this, but in Mississippi, we're easily 5 to 10 years behind national healthcare trends in
Mhm.
terms of adopt them and implement them into our state system.
Yeah. Which is not always the worst thing, depending on what it is, but often that has been a detriment to us.
That is very fair. I think telepharmacy is a great, like, our state's been really slow to allow remote
Mhm.
prescriptions and telepharmacy, and even telehealth has been restricted
Agreed.
a good bit, which has protected Mississippians a lot. But those insurance offering that they had to go with before was like a shared health plan, like Samaritan's Purse or one of
Mhm.
those religious kind of medical sharing networks. And bundling that with direct primary care so that you had some coverage, like for
Mhm.
catastrophic, or you could go to the market and just get a traditional catastrophic plan and then have the preventative care through the direct primary care model. But I mean, think about that. Like, you and I, as business people and understanding the business side of the market, can wrap our heads around that model. Try
Yeah.
taking that to your everyday person who's working a 9 to 5 in the local community. They've always gotten insurance through their employer, and now you're coming and trying to explain to them how you want to change it, and they've got to do this and that, and it's going to be better and what. Like, it is a hard sell.
Absolutely. No, I completely agree. And I think that's why we've had limited success with it so far because it's not a one-stop shop, easy turnkey kind of a solution. You have to think a few
Mhm.
steps into it, and it's such a big thing for families. If you mess it up, I mean, what if you get in a car wreck and you
Mhm.
slice an artery and now you're going to the hospital and oh, whoops, our health insurance is messed up. It doesn't cover this. Or you get a $1,000 bill in the mail. That's catastrophic for most families.
Right.
95% of families will go bankrupt or end up paying $50 a month for the rest of your life on this hospital bill. And so getting that right is concerning and most people won't adopt it out of the fear of what if I did it wrong. So if we
Mhm.
can get this easy, a nice turnkey easy process for people like really our traditional healthcare plans are, I think this would work. I think it would work really well, but we need that bundled, easy, sign on the dotted line and you're set up and you're good to go kind of a process. And I just don't think we're there yet.
No, and I think primary care has a fundamental marketing problem. Like, primary care should really be marketed as preventive care. And I think even over the last, especially the last few years since COVID, we've seen a massive shift in the
Mhm.
healthcare industry towards preventive care and wellness. You especially see it from the federal payers like Medicare. And so the direct primary care model, if they continue to market that way, it could be successful. Like, just for perspective, we have hundreds of medical clinics in Mississippi, probably close to 1,000 if you include all the specialties and mental health and primary care and everybody. I want to say there are 4 direct primary care practices throughout the entire state, and 3 of
Yeah,
them are
there's
in the
not
central.
many.
Yeah,
Yeah. Yeah,
not
there's
many
not
at all.
many at all.
But going back to that direct to consumer model, like, there is a massive opportunity for primary care. I still just think it should be marketed more as preventive care, and it would actually target more generations. Like, someone my age right now is probably not going to pay for a direct primary care membership, but somebody my age who, maybe like, I play golf, I'll play in like local competitive, like, men's soccer leagues or whatever. So some
Mhm.
things like that, you know, if I was marketed something as like preventive wellness or something to help keep me on
Mhm.
track to do those things, you're probably going to get my attention, or someone in my generations or our generation really attention, much more than just, hey, primary care, because you don't want chronic diseases down the road. I mean, yes,
Yeah.
it's a concern, but there is a part of me that's like, all right now.
Yeah, and I'm getting to the age now in, early to mid 40s where all of a sudden things are starting to hurt a little bit more. Going to the chiropractor
Everything's
for the first
moving.
time, starting to think, okay, I've got to start taking care of this body a little bit more because I'm hurting more than I need to be, and
That's
not
right.
even, to middle age quite yet. So now I'm starting to think down the road of, oh, let's start taking care of this car before the car starts breaking down.
Yeah.
And so, all analogies fail at a point, but I do think of it kind of like, speaking of cars, my subscription to my local car wash. I will go literally every day to that car wash. Whether it needs it or not, I'm going to go in and I'm going to sit there for 25 seconds while my car goes to the little automated car wash because I've got the little
Mhm.
sticker in the front and I'll pull up to the gate, beep, the gate
Yeah.
opens, and you go through the car wash. And I might just sit there and close my eyes for a few minutes and rest my eyes for just 15 seconds, 25 seconds. I might check email. I might listen to a podcast while I'm going through. If it needs it, I'll vacuum it out. But I'm just going through and I'm doing just a daily service on the car,
Right.
versus waiting for my car to get just filthy and then pay 5 times more to do the same car wash, the car not get all that clean, me spend a whole lot more time trying to clean it and get it looking good. And most of the time I drove around with a nasty, dirty looking car. So I say that to say what little bit of element that story actually has here, paying a less money up front and getting that car washed every day is keeping the car looking good, keeping the paint in better shape, making me happier with the car, and the car doesn't have to get that dirty ever. I say the same thing about our healthcare. If we could pay less upfront as a one-time payment, but more consistently and keeping ourselves well, eating well, going to the gym, getting testing in the doctor's office, and I'm feeling a little guilty here because I haven't done my wellness exam yet this year. But getting blood work done, making sure that we are healthy, altering things if things go wrong early, because down the road it's going to cost us severely if we don't
Yeah.
do that.
And we see that, Ron, honestly, with the chronic care management programs we run with
Mhm.
Medicare patients. I mean, we see that. We see, whenever that car goes unserviced for a long time
Yep.
and, the conditions pile up and an acute event occurs, it's tough for everybody. It's tough for the patient, it's tough for the family, it's tough for the healthcare system, it's tough for the payers. And so to your point, that kind of maintenance is crucial. And I think, while we're on the direct primary care train, that is a great option for local. This is where we're going to tie it back into those entrepreneurial listeners. But for like local healthcare practices, independent provider groups, even like endocrinology,
Right.
is a great one for this example. Local healthcare systems or community hospitals with outpatient clinics, all of those types of practices or facilities are primed to go out into their market, into their local communities, go and talk to business owners, go and talk to the large employer groups. They're all over, like around here, there are tons that are underserved, Continental Tire, Nissan, even Ergon. Go to these places with large employee numbers and offer programs like this,
Right.
and some of that is going to be just a great way for these practices to differentiate some revenue streams,
Mhm.
because providers are getting burned out on the rat race of you got to see this many patients each day to meet your numbers and
Mhm.
document the EHR. I mean, providers, especially in a clinic, are, working until 5 or 6 in the evening and then staying out till 10 or 11 at night documenting.
That's right. Yep. Which goes back to episode 1 of the ambient AI,
Yeah.
being able to document while you're seeing the patients hopefully will help hedge off some of that after hours care. But yeah, point taken, for our entrepreneurs in the local area. Think about what is missing and what can you do to fill that gap or that niche. What specialty or expertise do you have that the marketplace doesn't have, either globally, nationally, or just locally? And what can you do to help fill that? So I mentioned the one of, sport coaching, sports psychology. I think that is
Mhm.
one that's grossly missing. We
Uh,
talked about women's health. There's so many others, so many we haven't even thought of yet in the healthcare space that is an opportunity. We talk about wearables. I
yeah.
could see an opportunity for someone to jump in and be able to analyze your sleep patterns or your calorie burn and heart rate throughout the day and what that looks like and what that is doing to your health, to your energy levels. That could kind of mix into the testosterone or hormone therapies that we talk about. For those suffering from headaches, I could see
Mhm.
that. Migraine therapy is huge. My mom has suffered from migraines my entire life. My sister-in-law does now. I mean, migraines are debilitating. If someone could get in and focus on that and focus on the endocrinology side based on the technology we have now that you can wear and the results it gives you. I mean, there's all sorts of things that people will pay good money. I'm shocked by how much people will pay for a cheerleading uniform $2,000 for a cheerleading
Yeah.
uniform so that my high school daughter can cheer on the sidelines of a football game and do a little competition cheer. I promise you, people will pay 30, $40 a month if they
Oh, yeah.
can't function because their head is hurting or because they've got some sort of a mental block doing something. I promise you, there's a market for that. Find what that niche is and go for it. I
Yeah.
think there's
Absolutely.
opportunities.
I think the headache one's a good one. That one's insightful too. And prior to the podcast, I don't know that I could think of a direct to consumer niche that you could go to where either HSA, FSA, insurance, something like that, basically if it wasn't covered by one of those and it was direct pay from the patient, what service is the patient actually going to pay for? Because they don't like to pay for copays or coinsurance or anything now. So uh, I think one of the things that you just kind of hit on there as like a business psychology thing from an entrepreneurial standpoint is that the people are willing to pay more for other people
Mm,
rather than for themselves. So think about
mhm.
it. For your kid, you're willing
Or
to
for
pay
their
for that.
dogs.
You're willing to pay for that. Yeah, like dogs, yeah, pets. But you're willing to pay for that $2,000 cheerleading uniform for your kid because
Mhm.
it's not for you.
Yeah,
You don't have to feel guilty about it. You feel good about it because you did
yeah,
it for them and they get to wear it and participate and have a sense of pride around it and all that.
mhm,
Well, the same sense on the sports psychology side, that's where you get a parent or, somebody to direct
mhm.
pay for a patient to receive a direct to consumer telehealth service. It's not for them, it's for someone else. And it's a lot easier at that point to pay out of pocket,
Yeah,
right? Because
absolutely.
otherwise, I mean, anytime you offer a service, first question any patient asks is, does my insurance cover it?
Yeah. Well, and who likes to go to the doctor and wonder, what's my copay? Is it
Yeah.
$15? Is it $50? Is it $100? Is it $200? We don't know until we get up there and we check in and then we give them a card and they tell us how much it's going to be. And that's for a primary care visit, let alone in a hospital for an inpatient setting. We just wonder how many zeros are at the end of the bill. And I remember when my daughter was born, this was 2009, and I'm here sitting here gullible. I have no idea what's going on. And we have insurance and we go through and we prepay for the pregnancy and for the delivery. I think it was maybe at that time like somewhere between $700 and $900,
Mm,
something like that for the delivery. And unfortunately, my daughter had jaundice.
mm,
She was born a little early. And so she had jaundice, which looking back, not that big a deal. But she went to the NICU for a few days, and she was under the little Billy light, which we like to tease was her first visit to the tanning bed.
yeah.
And I went down to the billing office and I just asked, okay, look, so give me a ballpark of what's going to happen here. Do I owe $100, $1,000, $10,000, $100,000? Just get me in the range of the number of zeros that are going to be on the bill. And they basically like, look, we just can't tell you. It has to go to the insurance company. They have to do their thing. They have to send the bill, send it back to the hospital. The hospital then has to decide whether they're going to accept it or they're going to challenge what the insurance company gives them. And then they will inevitably, maybe a month later, or more, drop a bill to us on what the negotiated rate is. And that's fearful, especially, young person, first kid, no money,
Mm,
not knowing what the price tag is before you go in for something is really the source of a lot of people's anxiety over healthcare, and rightly so, which is why I like the membership model because to the penny how much you're going to be paying per month for whatever the level of care is. And most direct primary care settings is unlimited to an extent. I like knowing how much I'm going to pay and I can budget for that versus
yes.
wondering, oh gosh, now something's hurting. I've got to go to the dentist. I got to go to the doctor. I got to go to the hospital. How much is that going to cost? Am I going to break the bank? Do we even have enough money to pay for this service? And
Mhm.
so many cases, the answer is no for a lot of families.
I think you just kind of poked at a very common issue for a lot of Americans. I didn't know this until recently that 67% of independent bankruptcies are filed as a result of medical bills that they couldn't pay. I mean,
And
like
what is
that's
I forget what it is. Let me do a little chat GPT here. I'm curious how many families in the United States have less than $500 in cash at any one time. I forget what the actual percentage
oh
is.
gosh, it's going to be higher than you want it to be.
Yeah, absolutely. US have less than $500 in cash. Let's see.
Let me take a guess. I'm going to say as high as like 65 to 70% of the population probably does not have, I'm not going to say 500, but I'm going to say 1,000. They probably don't have 1,000 or more in a savings account.
All right. According to a 2024 survey, 39% of Americans have $500 or less in their savings account, with 36% reporting less than $100. 2025 poll confirms that half of adults have $500 or less in their savings account. 39% have $250 or less. $250. That is nothing. That is literally nothing. Federal Reserve data offers a similar perspective. 18% of adults say that the largest emergency expense that they could handle using only savings is under $100. Wow. That is just shocking. $100 is the largest that 18% of adults in the United States of America say they could handle if an emergency comes up. That is not even the copay that my wife had to the chiropractor last week. That is shocking.
Yeah. No, I wonder what it is for, I guess my 1,000 guess was probably too high up on the threshold then if they're measuring.
Well, it depends. I'm looking at all the different numbers here. Approximately 42 million U.S. families out of 4.5 million, so that's roughly half, potentially have $500 or less in cash or savings.
Gotcha.
I mean, that's 42 million U.S. families. So 1 out of every 2 people, and I would say in Mississippi, we're probably a much higher percentage here, just given the socioeconomic status of the state, have less than $500 in free cash. Anything inpatient is going to wreck you. And even a doctor's visit. I mean, depending on your insurance product, if you have a bronze plan on the exchange, I forget what the copay is on that, but it's not good. And the deductible is what, $5,000 for a bronze plan or more, 7,500. I forget what the number is now, but it's high. So underinsured.
Yeah, 5 to 8, like the $5,000 to $8,000 range is pretty common for a lot of the deductibles and the plans now on an individual basis.
Yeah.
And the thing that, the thing that's interesting there is like the amounts that you just rattled off don't even cover what it would cost for an individual's health insurance.
Yeah, it doesn't. Now, it may include the health insurance, but health insurance is only going to get you to the door. They're going to pay for everything above and beyond the deductible for the most part, depending on the product. But you still have the copays. The copays alone are going to wipe out a significant amount of the free cash that most families have. Not to mention if the tire blows out on your car or the AC goes out in your house or whatever happens, one catastrophic thing, not even catastrophic, I would say catastrophic is your entire AC system goes out, you got to replace the HVAC system, or your roof leaks and you got to replace a roof. That's catastrophic. It's a minor inconvenience. Like you run over, a deer runs in front of you on a country road at night and it dents your hood and you got a rattle going on in the engine. That's $500 right there.
Yeah.
So any level of healthcare related expense that's about that amount is going to just destroy families. That is a horrible, horrible statistic. And of course, we've seen this before. We know it, but it's important to restate that because that is the state of our healthcare system for 1 out of 2 families in the U.S. They are underinsured and or have very, very, very little money to pay.
Yeah. That's that great
On the flip
point.
side,
On the flip side,
I was going to say on the flip side, there are families that do have money to pay, and they're the ones that are prime for a company to come along and provide a really good service for a good price. And ideally, if we could provide that service for those who can pay and also find a way for those with very little money or a creative solution that can involve an insurance product that they can get a hold of through an employer or through individual to partner with that service and be a win-win for everybody. So kudos to the entrepreneur that finds the way to split the atom there and do both.
Yeah, there's still just a part of me that goes back to that HCA or HSA and FSA opportunity and targeting, because whenever I originally looked at whether or not that could be an option for us several years ago when it wasn't, but as a reminder, it is now, there is a significant amount of HSA and FSA dollars don't quote me on the exact number, but it's somewhere north of half a billion. So
Mm.
like there's literally almost $1 billion market of just unspent HSA and FSA dollars every year. So there, and
And
I don't think it's the HSA, but I think it's the FSA that
maybe
may
the FSA.
go
When I
away.
do really appreciate some of the new policies coming out where the HSAs, and I'm not sure about the FSAs, but the money is a little more flexible to be used. You can use it for educational expenses or retire, or nursing home or assisted living services later on. So it gives you some additional options on how that money can be used, and that I think is a really good thing. That's actually what held me back. So I don't have an HSA right now, and it was mainly because of those early policies. I was a little concerned putting money into something that I wouldn't use later on, and it just get locked in. So now that there's additional flexibilities, I'm much more likely and have been looking into starting to fully fund an HSA because of that.
Well, from a financial side, if any listener is interested, an HSA is actually a tool that we see a lot of older individuals either getting ready for retirement or in retirement that have used those accounts and contributed to them over a long-term period, because I'm pretty sure like there's creative financial things that you can do there. Like when I was saying the FSA money may go away, I don't know if it's FSA specifically, but there's a type of account like that where it's kind of a use it or lose it, right?
Mhm,
And that may
mhm.
be FSA. HSA is the one I think that you're talking about that's more open to be used to pay for different things.
I think that's right. Mhm.
But people can contribute to those over years and years and years. And they're using those as like retirement funds for medical and healthcare needs. So that
Right.
in retirement, I mean, think about it. Medicare is not great from a healthcare coverage standpoint. They do cover things, but some of the gaps there are pretty large for a lot of people. You've got really, really expensive health plans available to people. And so HSAs are a way that people are kind of padding against that so that whenever they need home health or other types of therapies or, whatever else they might need, they can just dip into that. Because I think you can also leverage like some loans and investments and things against an HSA account.
I think you can. Yeah, I've even heard of people, like I think it was an HSA where you can even like purchase real estate through it, which I do not recommend doing, but I think you
Uh,
can as a portion of the investment strategy in the HSA. But I mean, most of our healthcare costs is in the last 10 years of life, even in the last few years of life is even more. And so having that product there to help cover those costs, I mean, that helps your family if nothing else.
mhm.
We've got parents that are getting older. My last grandparent died a couple of years ago, but seeing the cost that they all went through during their last few years of life and the healthcare that required, it's the majority of the money you're ever going to spend in healthcare is in those last few years for the vast majority of people at least. And so preparing for that early is important, and having a product there that can help you to cover anything above and beyond what Medicare would cover at that time, or your private insurance if you're still below Medicare age. That's important. We need that, and those products are going to be good and helpful.
Yeah, no, I agree. And we see that with Medicare. I mean, Medicare spends $1 trillion a year taking care of patients that, 80 to 85% of that cost is managing chronic conditions. And
Mhm,
that's, what, 15% of the national healthcare spend is Medicare, 20% of the
mhm.
national healthcare spend is Medicare. I think just the numbers alone show us that cost at end of life, especially whenever things go unmanaged, is really expensive. But to go back to those direct to consumer options, and those opportunities there, chronic management is also a great one,
That's right.
for providers, community hospitals, independent groups and practices to offer to patients. And so there are a lot of, I guess, from what we've covered, there are a lot of preventive models and there are a lot of reactive direct to consumer models that can be covered by insurance or it could be direct pay. And so I think we see a ton of opportunity, even just with the growth of companies like Hims and Row and Keeps
Mhm,
done, some of these others have shown that there's a market for this and
mhm.
that market is continuing to grow. While some of the traditional markets that, a decade ago you and I thought, would have staying power forever have kind of waned a little bit. I
That's
mean,
right.
look at Teledoc. They were once a 60 plus billion dollar company, and I think today they're just shy of 2 billion.
Yeah. I know. And some of the ones that are out there now may do the same as the marketplace. It's going to drive success or failure, and that's part of the fun of the roller coaster that we're all on. I'm curious. Well, I have not used one of the direct to consumer products, the niche ones we're talking about. I mean, I've used American Well, I've used Teledoc. I've not used, Hims or Row or Lemonade or any of those. I don't know. Have you used them? Do you know anyone who has, what their experience has been so far?
I have not, but I do have um a family member. I won't call him out.
Probably best.
Yeah. I do have a family member who has some hair loss that he's used Keeps for.
Does he
And
like it? Because I'm getting a little thin in the back here, so I may have to give him a call sometime soon.
he's done different stuff. Like they have an oral product, they've got a topical product, they've got some like serums or oils. And so I forget what the name of the drugs are, but they've got these different solutions. And, I would say like there's some, yeah, like I can notice some, but it's one of those things where, I would say his personal experience probably doesn't match up with the experience of those they show in the ads. Right.
Before and after.
Yeah, those
Before, it's
use
almost
cases.
bald. After, it looks like Bigfoot.
Yeah, yeah, full head of
Yeah.
hair. It's like, all right,
Results
Fabio.
may vary.
Yeah, results may vary for sure. But I do know some others that have used like the direct to consumer mental health apps, for depression or anxiety. I think Cerebral was a big one that popped up a few years
That's
ago
right.
that ended up coming under, I can't remember if it was FDA investigation or FTC investigation, something. The CEO had to step down. But, some of those companies that they seem to be in like a gray area.
Mhm.
There are a lot of patients, like other things, like there are a lot of patients that they're helping. There's a lot of good that they're doing, but there is still one side of it. Like if you look up these companies and just Google lawsuit next to their name, you're going to find lawsuits tied to every single one of these companies
Sure.
related to what sounds like suspicious prescribing activities. A lot of these companies, whenever they employ providers, what we see is that they incentivize the provider based on prescriptions. The only
Mhm.
way you get to a prescription is through a diagnosis. Well, if that's the only way that I'm getting paid, where's my incentive?
That's right. And that's probably where most of the issues in telehealth are starting to break down now is not the concept and not the practice, but the payment methodology. If you are reimbursing, and it's the same thing for inpatient care, if you're
Mhm.
reimbursing based on diagnoses, that's the same thing as paying a teacher based on the test results of a student
Right.
or paying a
That's a good
cop
example.
based on the number of tickets they write. I mean, there's any sort of way that you can reimburse someone or pay someone and incentivize someone to do something, but good and well, if you incentivize them to do something, they're going to find a way to do more of those things, whether it is right or wrong to do them. So if you incentivize a police officer based on the number of tickets they write, you better believe you're 1 mile per hour over the speed limit or
Right.
your tire moves just the slightest bit at a stop sign and they're going to write you a ticket because they get an extra $50 to do that. Don't know if that's the case anywhere. So, but if it is, obviously it's going to be much stricter on what they're going to do or much looser on how they judge it. And same thing in healthcare. If a physician is reimbursed based on the number of prescriptions or the number of diagnoses that they provide, they are going to write more prescriptions and they are going to provide more diagnoses. It's inevitably going to happen.
Yeah.
And so we need to, in my opinion, find ways to reimburse people in a way that is maybe more ethical and also better use of healthcare and the dollars that are in healthcare. Because we don't want to drive up healthcare costs anymore. The goal is to reduce costs and make it more efficient and
Right.
effective. And so I just think we need to have levels of corporate responsibility to do that. But also, we don't want to take away incentive. Incentive is good. What are
Mhm.
ways we can incentivize better? Maybe do it based on the number of encounters that we have, regardless of the diagnoses, or how well we can keep patients healthy. Whatever we can do there to keep incentives, but also to do so ethically, morally, and what's in the best interest of that patient.
Yeah, and I think value-based care is trying to take a stab at some of those alternate payment models. Some of the capitated models that we've seen over the years have taken a stab at that as well. And at I don't know, at the sake of kind of posing an interesting societal question, I think it's also worth asking from a certain point, like, where does where do we at what point does the patient responsibility come into play here?
Yeah,
You know, because we're constantly trying
absolutely.
to figure out how somebody else pays for it, right?
Yeah, absolutely. And that is the underlying problem I think we have in a lot of healthcare is that patients either are not health literate enough to be able to advocate for themselves, or they just don't do it. And that is somewhat on the system for not teaching patients well enough, teaching people about healthcare, somewhat on the system for being too confusing, and also on the patient for not educating themselves and feeling confident in what they need to do to advocate for themselves, to understand their healthcare, to take ownership of their healthcare. And I say that
Right.
personally, it is on me if I don't do something correctly. It is not on the doctor, it is not on the system. Maybe they took advantage of me, but you know what? No woe is me. That's on me. It is my
Right.
responsibility to educate myself, to learn, and to advocate for myself and to my children and my family. And so I don't give a lot of free passes. There are some good examples of ones that I think are justifiably given, but I think it is our responsibility to do that.
Yeah. And that's where it's tricky, you know, because until that is more of a socially acceptable kind of thought or I guess behavior, really, then we're going to continue to have to figure out how to get insurance to pay for things. I think what, you know, some people forget about the economics that like if we're constantly trying to figure out how to get insurance to pay for things, well, you know, how you fuss about your insurance premium going up every year, that's why, you know. And
Yes.
like your car analogy is a great one. You know, it's taking care of your body is a lot like taking care of your car. And so, you know, some of that personal responsibility, you know, I do think falls on us. And insurance is a great tool. And I think that we use insurance as a tool as necessary, but there has to be some patient responsibility, even just to improve some of these conditions, because especially in our country, like the amount of chronic conditions and some of these factors that really burden the system are just constantly increasing. Numbers are going up. More and more people are developing these conditions, and it's just a drain on the
Yeah.
system.
And not to dissuade too much in the economic side of this, but you hear more and more and more people talk about the cost of living is not is it's impossible to live in modern society for college graduates coming out, young families. And in some places in this country, 100% agree. West Coast, California, Portland, Oregon, Seattle, Washington, Chicago area, especially in the city, New York City area, to an extent in city, Austin, Texas, Asheville, Tennessee, areas like that, extremely expensive. Don't know how you do it
Right.
unless you may have a really big job. I don't think it is possible to live in those areas. If you have a $1.2 million starter home, that is not affordable whatsoever. But for most of America, including all of the state of Mississippi, it is very possible to live on at or very or slightly above minimum wage. But big caveat here. Everyone likes to go back to the 90s and 60s on how people lived there.
Mm.
There was no cable television. You had airwaves. We had a radio in your living room. You had one car. That car was not expensive. Insurance, and this is really where the crux of where I'm talking here,
Yeah.
covered only what insurance is supposed to cover. It did not pay for anything out of pocket. It covered catastrophic care. You
Yeah.
wreck your car, insurance will cover the cost of the car. You ding your windshield, it doesn't fix the crack. If you go to the doctor, you pay cash for that doctor's visit. Insurance never covered that. It only covered it if you had a catastrophic issue. So we've added cost. Cell phones. There were no cell phones back then. You had a landline phone that went to your home, and that landline phone went into a switchboard that an actual person took a knob out of a wall and
Yeah.
stuck it in another knob so you could ring your neighbor. And you also only had a limited number of lines. So yeah, cost was really, really minimal back then. So you had your home, you had food, and you had gasoline for your car were the majority of expenses that families had, and you could live on that. Now we got a subscription for every cable channel we can think of and all the apps on our phones and all these other things that we do. It's funny because I'm now talking against the subscription models that we've been talking about. But think of the life we have now. Don't compare life in 2025 to life in 1955 because it is apples and oranges to the extent to the extreme. Life is just different. And so we could go back to a 1955 lifestyle and we could all live. But if we're going to live in 2025, you're going to pick and choose what you do and understand that it is a very different life. I think you can still live and you can thrive under a very minimal income, but you have to be smarter with what you do, which means controlling healthcare premiums, understand what you're getting out of these subscriptions that we have. Don't over subscribe to all of these different things and then have it run in perpetuity. People waste hundreds of dollars a month on subscriptions we never even think about.
Yeah,
So
absolutely.
make sure if you're going to subscribe to direct primary care or one of these services, use it. And if you don't use it, then get rid of it. But these things are here to help, not just to be a chain that bogs you down. So I don't
Absolutely.
know if that's encouragement to anyone, but just be smart with what you do, and everyone can live in this modern society, with the exception of the extremes, which obviously are different.
Yeah, I don't know anybody that wants to go back to 1955 or 1960. It's if they
There was air
do,
conditioning back there. I don't know if you realize that, but my
oh yeah,
parents talked about sitting after going to PE and sitting in a sweaty classroom with sweat dripping on their pages as they were trying to work. I don't want to go back to that. I can promise you.
yeah, no, I do like my modern amenities, and whenever people talk about, kind of the way things used to be, I kind of wonder if it's more of a, like more of the societal norms, more of a moral or an ethical longing rather than, a certain way of life longing.
That I want. I'll
There,
sign me up for
there's some
that.
of that. Yeah, I can get on board with that. I do think,
Yeah.
interesting case study for another day, but you poked another good kind of topic there with the insurance models now prior to Medicare, quite
Hmm.
frankly, in the 70s,
Hmm.
or I guess late 60, 69 or 70, whenever it was signed into law. Office visits were not paid for traditionally by insurance
Right.
until Medicare. And
Right.
so I do think there is an interesting, kind of side to the argument of like, well, this is just how healthcare is. It's big, it's complicated, it's convoluted. It's always been this way, that sort of thing. And I think it's good to remember that, like, no, like what we know is our modern healthcare system that we think is the end all be all or
Hmm.
the way it's always been or whatever is about a 50-year-old system. And that's it.
Exactly. That's right. And if you talk about post Affordable Care Act, well, we're talking about, late 2000s where that, well, I forget the year. Was it 2009, 8? I forget
It's
the
the
year now.
ACA. I think the
Yeah,
ACA was 2010.
2010. Okay, thank you. So 15 years of post ACA, which is really the kind of the framework of our modern healthcare system, even more specifically. So yeah, very good point. Everyone complains about the United States healthcare system being too costly and confusing, which I agree with those 2 points. Now, the question is why, and that's maybe a topic for another day. There is an answer to that, and I know what the answer is, but we'll save it because we'll be here for another 2 hours.
That's right.
But when, the Trump administration, whether you like the administration or not, comes in and tries to bust up healthcare and change it, and everyone's complaining, oh my gosh, we're going to lose our healthcare. Well, you know what? If healthcare sucks and you said it sucks and now we're trying to change it, why are you arguing about trying to change it? I don't know if where changes are going to be for the better or the worse. I'll be honest. But what's the definition of insanity? Trying the same thing over and over and expecting different results? Well, if
Exactly.
we know it's bad now and the things that we've been doing are just making it worse, what's the harm in trying something different? Let's bust it up a little bit and let's see if maybe we can create some efficiencies and get rid of some fraud and swap out what we're doing with HSAs and reimbursement models. Maybe we might make it better. And if we make it worse, well, it was already getting worse anyway. We just escalated what's already a bad system. And then we realized, okay, well, wrong direction. Let's turn around. But we know it wasn't going in the right direction before all of this. So I'm all for it. Let's try to change some things up. I say the same thing in education, but again, topic for another day. Let's
That's
change
right.
some things up and let's see if we can make some improvements, make everyone's life a little better, make healthcare cheaper. And if we fail, well, we were failing anyway. So we'll just try a different direction next time.
Yeah, I think, the change things up is a great point because what have we heard media talk about for the last 2 decades? How the US has the worst healthcare system in the entire world,
Mhm.
right? And how it's just so awful and bad and everything. whenever objectively compared against other countries, we do not have the worst healthcare
No,
system.
we
There's
don't.
plenty,
That's a lie.
plenty of countries that
Absolutely.
have a worse healthcare system. And that also implies that somebody has a perfect healthcare system, which
Mhm.
no one
No
does.
one does. That's right.
And so,
There are some interesting models I think we can look at that are out there. Of course, every country's different. Every population's different. Cultural norms are different. These all play into healthcare.
yeah.
Diet, lifestyle, they all play into healthcare.
And it's
Oh,
interesting with like how complex the system is that there are still these direct to consumer opportunities that we've talked about. Whenever you think about like how broad and expansive and how full of depth just the service offerings that we know of now,
yeah,
like there's literally a different specialty for, everything now.
that's
There
right.
is a different like you can like even nurses can specialize now. You've got all of these kind of sub niches within the system, and there's still tons of underserved, which I guess just is one thing that's kind of exciting about being an entrepreneur in healthcare is it really is kind of like the ocean in a way.
Mhm.
Like it's hard to find the hidden depths. You can just swim and swim and swim, and you're going to continue to find blue ocean and opportunity.
That's right. Absolutely. And that's the cool thing is when you alluded to this, when you talk about the American healthcare system, we are littered with problems.
Mm,
No question. Everyone is. But what are the bright spots? What we're talking about today is clearly one of the bright spots. We
mm.
are helping people in very specific, difficult ways like we've never been able to do before, utilizing technology, keeping things private, making it accessible at people's fingertips. This has never been able to be done before. And the United States of America, whether people like to admit it or not, we are leading the way in a lot of these technologies and a lot of these innovations. And it is great because it is a global model and it can be taken by anyone, but we are leading the way. And there's a lot of great entrepreneurs, a lot of great companies. We've named several of them on this podcast here that are fantastic and they are doing a great job. And we know people that are using them on a daily basis now, and it is transforming healthcare in a positive way. So when I think about our healthcare model, that is one of my bright spots, and it is what I believe should be the future of healthcare is at your fingertips, easy, accessible, turnkey, and focused on wellness and prevention in a sustainable fashion.
Yeah, hymns, I think embodies that. And just to talk about that bright spot, just from a market standpoint, quick numbers, 2020, 149 million in revenue, 2021, 72 million in revenue, 2022, 127 million in revenue, 2023, 172 million in revenue, 2024, 1.5 billion, forecasted for this year about 2.5 billion.
As a small note, Hims is not sponsoring this podcast, but we welcome it. So if you anyone from Hims watching this, we do welcome your sponsorship. And if you want to throw out a free trial membership for Will and I'm sure we would take it for a nice test drive.
And you help Ryan and I with our hair loss.
Well, yeah, I had the hair loss. You've got some nice looking locks there. I just got a haircut today, and I told her not too good, not too much on the back. We got to keep what's there.
Hey, I've gotten to where I tell my barber, he pulls out those thin shears, and I'm like, no, I'm good.
Yeah, exactly. Don't need them anymore. That was 19 or that was 20-year-old Will, 20-year-old Ryan. We don't need to thin it anymore.
That's right.
God is taking care of that on his own.
That's right. But yeah, no, I just want to highlight those numbers from like a bright spot, just in terms of like the market opportunity, because the bright spots are obviously there. You've got companies like that have come into the market and are growing at that rate
Mhm.
and capturing, more and more. And, it's really that kind of, like you talked about, that ease of use, the consumer first model, which, I think at some point healthcare just lost,
Yeah.
like maybe the doc used to come to your house and he knew you
Mhm.
and your family and everybody else. And that was some consumer first, but at somewhere in the last 50 years, we've kind of lost it.
And
I,
I
but like they
genuinely
even
hope we
have
get
in
that
med
back.
school, I think they even have like seminars on bedside manner.
Yeah, that's right. Yeah, bedside manner, something that we very rarely are able to even use anymore. So, no,
Yeah.
I agree completely. And that's what excites me is I think we're getting back to some of our roots, and I think that's going to be very positive for the American healthcare system.
I agree,
So,
man. I agree. It's exciting. It'll be nice to see over the next couple of years, especially with the AI tools and
mhm.
how they're increasing the development and startup opportunities. Who else gets into this space? Because quite frankly, the last couple of years have been a real kind of low point in digital healthcare funding and startups and kind of
Yeah.
new companies to get excited about, right?
And no question, we're going to see mergers and acquisitions as AI merges with the tools that are there. And so, some of the examples we used here could very well merge with some of the AI examples we used in our last podcast and form different mergers and acquisitions and mega companies. And they, all work together, very possibly even owned by the insurance companies, God forbid. And so it's
Rise
going to
of the
be
pay
interesting to
vider.
see what's that?
I said the rise of the pay vider, when the payer and the
Yeah.
providers
Right.
merge.
Exactly. I mean, you see CVS Caremark is a good example already. I mean, and then you get into trust litigation and what is that going to look like? Monopolies that are formed. I mean, it's going to be a wild world on how this works. But it's going to be interesting to see. I think there's a lot of positives that are going to go. Obviously, there's going to be some negatives. There's going to be some problems. We're going to have to navigate the waters on that. But overall, I like the direction. I like the turn we've taken recently. I think there's
Sure.
some trajectory that we've been going on for a while that's been good, especially from the telehealth, teleconnectivity side. Even when we didn't know what we were going to use it for, we knew it was a good thing.
Right.
And more, I think we're moving in that direction. So I'm very cautiously optimistic right now on all this.
Yeah, I am too. I think there's some kind of refreshed momentum that hasn't been there the
Mhm.
last couple of years. So yeah, to your point, the wind's back in the sails, and this tool is starting to, find more applications.
Absolutely. Well, Will, that's about it for our podcast today. Any closing remarks or final words you want to provide for our listeners?
I would encourage everybody to not limit themselves in their thinking. It's kind of what we always say. Whenever, like, regardless of the size of your practice, whether you're a single provider practice or a multi-group specialty or a part of, a chain of, 60 clinics or whatever you are, there is an opportunity probably in your local community to go find some employer-based contracts and serve a niche, whether it's diabetes care, whether it's preventive care or wellness or something, and employers will pay for these things because they're the ones paying the cost and they're expensive. And so that's kind of I guess, hot takeaway there is if you wanted to find a way to apply what Ryan and I have talked about in the podcast in your entrepreneurial journey, you don't have to look very far outside of your community. You can go find some local business to partner with, depending on your specialty or your service offering. Use what you already have. You've already been seeing patients. You already have data on what you've been doing, and just go to them and say, hey, here's what we're doing and it works. And we're already in your community and we can engage patients and will help reduce your healthcare cost. It's just practical example for go out there and start offering these. Don't think that you have to be, this San Francisco venture-backed company with a fancy app and $30 million in funding. All you need is a provider, what is it, a doxy.me account or whatever, the free telehealth platform, and you can go out there and, make some magic happen.
Absolutely. Words well spoken from a man that does it on a daily basis. So, with the Healthcare That Clicks podcast, my name is Ryan Kelly. Thank you, Will Moon. It's our pleasure to host this. We hope this has been helpful to you. Thank you all for being on. We appreciate your time today.
Until next time.